Hello, my name is Dylan Hoffman. I am a student in the Indiana State DAT program, and this quick summary is going to be about my approach to low back pain treatment and how I select my treatment. So, if I was just going to summarize the way I select my interventions and the things that I do, uh, it's really shifted mostly, I would say about 2 or so years ago when I was introduced to the TBC treatment based classifications. Specifically, I've kind of focused the way that I operate on the Lido TBC, and I put a lot of emphasis on manual therapy through that. So I'm able to evaluate somebody and then decide, are they going into mobility, stability, specific exercise, traction categories, and then I'll select interventions that I have in my tool set that match that category that I've placed the patient in. And by doing that, I'll really focus a lot of my manual therapy either on the specific injured site that may be hypomobile, or if it's a hypermobile situation, I'm going to be focusing a lot on stability exercises and exercises to address the instability that's there. I may instead look above and below that area of the low back and address the hypomobile segments there, whether that's hypomobilities at the hip or hypomobilities in the thoracic spine. My comfortableness with TBC and low back pain patients has also increased tremendously. I can think back to my first year as a certified athletic trainer, and I was still kind of under that mindset of back spasms, and we're gonna just mash on trigger points and do some core exercises. And we had some success with some patients, and not a lot of success with others. And it really wasn't until I was specific and intentional about the treatments that I selected that I've seen the best improvements. So I feel pretty comfortable in my ability to evaluate the low back. Uh, do I still miss things? Of course. But even if I'm unsure about a specific diagnosis, I am still confident enough that I can place them in the right category. And I think that's where you see the most importance coming from the TBC models, is that I may not be able to get a specific pathological diagnosis, but I'm still able to put them in the right category and see results from my interventions, even if I can't find a true mechanical source for that pain. And so I think that's really important for athletic training to continue on. If I were to kind of compare myself to other athletic trainers, which I don't really like doing, but I am pretty confident that my knowledge and skills of low back pain treatment is better than, say, an athletic trainer who has not been fortunate enough to have the experience and the learning opportunities I've had, whether that's through the DAT, through a residency, etc. So comparatively with other athletic trainers with the same amount of time and experience, I am confident in my abilities. So thank you for listening. That's my summary of treatment of low back pain.